both intimately related. Cardiac output is the volume of blood that is pumped by the left ventricle every minute. And as mentioned previously, cardiac output is about 3 to 6 liters per minute. Cardiac output is influenced by heart rate, ventricular contractility, blood volume, and of course, a venous return. Venous return, because if the venous blood is returning back to the superior and the inferior vena cava, well, then of course, there's more fluid there. So every time that the fluid gets to the left ventricle, it's going to pump a greater volume. That's why your venous return is related to your cardiac output. The blood volume, if you are losing blood, well, the volume of blood coming out of your left ventricle is going to be limited. That's how volume influences cardiac output. And then ventricular contractility. If you have cardiomyopathy, if you have left ventricular failure, that ventricle is not pumping well. So the volume that comes out is limited. That's how they're related as well. And your heart rate. Now, the heart rate's a little bit different, simply because it's a concept that I want you guys to understand. If my volume, my cardiac output is insufficient, it's not coming out. Remember, signs and symptoms are based on your body's attempt to compensate, to fix the issue. So if your volume of blood that's coming out of the left ventricle is not adequate, it's not within 3 to 6 liters, it's 2 liters, what do you think your heart rate is going to do to compensate? It's going to increase. Yeah, absolutely. It's going to increase. So that's how cardiac output and your heart rate are intimately related. If you have cardiac output that's insufficient, your heart rate will increase to fix the issue. If you have a cardiac output that's adequate, your heart rate will be anywhere from 60 to 100 beats per minute. It'll be regular. That's what I got from that particular point. Cardiac output is calculated by stroke volume times the heart rate. And then your tissue perfusion is correlated with cardiac output. If your cardiac output is adequate, then you're perfusing all your organs, and your chemoreceptors, your baroreceptors will detect it, and your heart rate will stay normal. But if at any point your cardiac output drops, then your heart rate will go up. Okay, so just make sure you guys remember that.